Individually, we are one drop. Together, we are an ocean. Welcome to the International Maternal Newborn Health Conference 2023. The first time we've all gathered in 8 years. Take a moment to look around at one another. We are colleagues, we are peers, and we are friends. And together, we share the spirit and soul of the maternal newborn health community. This week, we'll be aligning together to ensure we meet the ambitious but achievable 2030 Sustainable Development Goals. Accelerating together to advance solutions to improve maternal and newborn survival and to prevent stillbirths. And bringing forward new evidence, sharing ideas, and driving efforts to save lives. Together. Thank you for being here. As a community, we have the insight, experience, and motivation required to overcome the challenges we face. And we have the spirit that it takes to drive change. As we know, progress in maternal newborn health and stillborn reduction has been made, but it has been inconsistent, too slow, and often does not account for the combined needs of the mother and newborn. In 2000, neonatal mortality accounted for 41% of under 5 deaths globally, but it is not reducing at the same speed as under 5 mortality. And in 2021, it accounted for 47% of under 5 deaths. From 2000 to 2015, the maternal mortality ratio declined by 33%, but since 2015, it has barely declined at all. A baby is stillborn once every 16 seconds. If current trends persist, 60 countries will not meet the SDG target for maternal and newborn mortality and stillborn reduction by 2030. By coming together this week, we are uniting in thought, dedication, and action to shift these trends. Together, we have made progress. We know that maternal and neonatal death and stillbirth often have common causes, and we can prevent them. A number of countries have achieved significant and measurable progress in maternal newborn health. So we know change is possible, and we can learn from these countries here at IMNHC 2023. We also know there are challenges. Limited financial resources need to be addressed to ensure that integrated quality care for mothers and newborns is part of a core package of funded services in every country. Poor quality of care and care silos generate harmful competition for attention and resources and fail mothers and babies. Important differences among regions and countries must be recognized, and communities need to be engaged in care. Innovations are also needed to expand access to services, fill gaps in existing services, and reduce inequity for women and children everywhere. As part of this, we must build strong routine data systems in order to measure progress so that we know if we are on track and to hold ourselves accountable. Together, we can achieve 90-90-80-80. That's 90% coverage of 4 or more antenatal care contacts, 90% of births attended by skilled birth attendants, 80% early routine postnatal care within 2 days, and 80% of districts with at least 70% ANC4, 80% SBA, and 60% PNC coverage. Now is the time to unite in action, because if we don't all make the SDG targets, then none of us do. Collectively, with our knowledge, our experience, and our spirit, we can ensure that all mothers and newborns not only survive, but thrive. Together, we are IMNHC 2023. It's not a moment, it's a movement.